Hi, everyone. I'm Dr. Julie Harper. I'm a board-certified dermatologist, and I practice in Birmingham, Alabama. And with me today is Dr. Zoe Draelos.
Hello, I'm Dr. Zoe Diana Draelos. I am a board-certified dermatologist. I'm a research and clinical dermatologist, and I'd like to share with you the findings of an acne study that I recently conducted. We studied a nutritional supplement, and we've always wondered if nutritional supplements are effective in acne. So we enrolled 100 subjects. 50 of them were assigned to receive the placebo, which was basically rice flour, and the other 50 received a blended nutritional supplement designed for acne. We enrolled individuals 18 to 49 years old with mild to moderate acne of all Fitzpatrick skin types. The study began after we supplied individuals with a standardized skincare treatment regimen consisting of a cleanser, a moisturizer, and a sunscreen. Subjects were then evaluated at weeks 4, 8, and 12, and we assessed their IgA, we assessed their non-inflammatory and inflammatory lesion counts. I assessed their skin, they assessed their skin, and we were looking for improvement in post-inflammatory erythema, post-inflammatory hyperpigmentation, acne, scarring, skin tone, smoothness, softness, and overall appearance. So we were focusing not only on the efficacy piece associated with acne, but we were also focusing on appearance-related data as well. This slide nicely summarizes the findings in terms of the investigator global assessment. You see the active in blue and the placebo in gray. So basically what you see here is that at weeks 4, 8, and 12, the percent of subjects achieving clear or almost clear was significantly higher in the active group as compared to the placebo group. We also noted that by week 12, there was a statistically significant increase in the individuals in the active group who had an improvement in their IgA rating. Additional data looking at the lesion counts, which were both non-inflammatory and inflammatory, also revealed significant improvement. As you might imagine, the placebo effect is fairly significant in acne studies because there are hormonal fluctuations, stress, and other natural fluctuations that affect acne that are outside the purview of the study. Nevertheless, there was a statistically significant superior drop, not only in inflammatory lesion counts with a 55% reduction with the active, and non-inflammatory lesion counts as well with a 46% reduction in the active. What we were basically able to demonstrate is that a nutritional supplement can be very helpful in acne. This shows the overall assessment in appearance as assessed by the investigator. And again, you can see that there was statistically significant superior results in post-inflammatory erythema, post-inflammatory hyperpigmentation, scarring. It was statistically significant for post-inflammatory erythema and scarring, but also visual smoothness, tactile softness, and overall assessment. It's very rare to find a really well-run placebo-controlled acne study, basically because the placebo effect is so strong. But here we were actually able to have an identical looking placebo and active, and yet the active did indeed result in superior results. This is an example of an individual who presented who had typical acne. And what you can see basically is improvement after 12 weeks with remarkable reduction in post-inflammatory erythema, especially in this individual with acneic scoriae. In an individual with Fitzpatrick skin type 5, you can also see a nice reduction in inflammatory lesions, as well as a nice reduction in post-inflammatory hyperpigmentation. Here we see an individual, skin type 1, who basically between baseline and 12 weeks of use showed a reduction in acne lesion count, but also a nice improvement in post-inflammatory erythema. And in this individual right here that has basically perinasal and perioral dermatitis, we also see a nice improvement in lesions as well as post-inflammatory erythema. One of the things in dermatology that we've always been focused on is there anything extra that we could give to individuals with acne that might be helpful? Many patients come in asking for a nutritional supplement to use in addition to traditional acne therapy. And this study demonstrated that it is possible to improve the appearance of acne with the use of nutritional supplements. Julie, what do you think about this data?
Well, first of all, Zoe, thank you for doing this study. And I'm just so thankful with a supplement like this to have a study of this caliber. We are not used to seeing randomized controlled trials with a supplement. So I'm really, really grateful to have this. This is something that I have used in my own patients as well. And I would say it's kind of what you just said. More often, this is driven by the patient. Our patients want alternatives to treatment. And in my practice, yes, this can be an alternative to treatment. More often, though, what this is an adjunct. And we have studies that come before this that show this just in the real world use of this being used in combination with other acne medications that we have. But again, I'm just so grateful to have a study that actually shows that this product can be beneficial to my patients who are undergoing treatment for acne. Very early on with this product, I had a patient that I had been treating for quite some time, and we certainly had her better. We just didn't have her all the way where she wanted to be. And so this was something that she and I talked about. We agreed to add this to her regimen. And it made really, I think, all the difference. Now, we could say it was just a combination of all of the different treatments that she's on, and I think that's probably true. But I can tell you what she credited, and this is a true story, she credited this supplement. So, for me, as somebody who has brought this into my practice, number one, I like that this is from Nutrafol. So Nutrafol with me already has a great reputation with their hair product. And now I have the option to use this clear skin product as well. So I like having that. I also like the science that is behind this. They did not just randomly pick ingredients to put into this supplement. They are very targeted at the underlying root causes of acne. Things like hormones and immune dysregulation and the microbiome and stress. So they have picked ingredients that are targeted to those specific root causes. The third thing I'm excited about with this is to have a randomized controlled trial. And they did not have to do that. Nutrafol could come out, they could market this to us without that. But they upped the game on this. And it is very, very rare to find this. What most people do in this category would be just an open label single arm study that shows improvements with good photos, but they went head to head against placebo. And so as somebody who takes studies very seriously, I think that is really, really crucial. And then lastly, I think what's important to me is because we have those prior studies that show that this can be used in combination with treatments my patients are already on. I like that. But then in this study that we just talked about, this was used by itself. So it gives my patients options. They can either use this solo if they want to choose to go that route with a supplement, or they can use it in combination with treatments that I've already prescribed. Thank you, Dr. Draelos, for taking us through this study. I always appreciate the high caliber of work that you always do. And thank you all for listening today, too. I hope you've enjoyed learning a little bit more about this nutritional supplement for our patients with acne.